This is a Power 98.7 podcast. Now we're talking. Subscribe to Power 98.7 podcasts in iTunes or wherever you get your podcasts. There's more on power987.co.za.
We are speaking to the ACDP, speaking to Mari Sukas, who's going to give us their perspective. But also joining us on the line is Dr. Katlego Muturi, Managing Director of BHF, which is the Board of Healthcare Funders, and Quinton Zunga, the CEO of RH Managers, to give us more context about their views on just the implications of the NHI bill. Quinton Zunga is the CEO of RH Bophelo. Good to have you on the program, sir. Now, I'm sure you'd agree with me that for the NHI to be successful and also, very importantly, effective, support will be required from the private sector here.
Absolutely. I think NHI needs proper infrastructure. We already know that the government infrastructure is already overcrowded, and there isn't much in terms of pipeline of new infrastructure. So whilst the funding for universal coverage is indeed an important thing, it's got to be mentioned that the private sector can support in the provision of the facilities needed to dispense of this private of this universal healthcare. Currently, the status quo, with just the public facilities, it would not be possible to utilize those benefits for a significant population that are currently on the private medical aid.
Now, the NHI bill is still the subject of fierce debate, especially regarding whether it will be captured by private and political hidden agendas. And we are looking forward to your views, Power People. If you do want to add to the conversation, simply drop us a message on Twitter. It's at PowerFM987. Remember to hashtag Power Business. On Facebook, simply search for Power FM. You can also drop questions for our guests, which we will relay to them as well. Let's speak to, despite the concerns raised, and be that as it may, there is no denying that there is this real need for a robust approach to addressing the state of healthcare in South Africa. Maybe let me bring in Quinton again. He's the CEO of RH Bophelo. Now, Quinton, speak to us about the role that RH Bophelo is positioning itself in to indeed ensure that South Africa has the infrastructure necessary to ensure the quality healthcare services are accessible to all here.
I think our group is looking to provide the infrastructure. We build 3 to 4 new hospitals a year, so we're pretty updated on the nuances of putting infrastructure for health. However, we also want to play a constructive role in making the ecosystem sustainable. We still believe a complete, wholesome NHI is a big elephant to eat, and one would have preferred a bite-sized approach. We already know that the government has been able to cover government employees through the GEMS medical insurance, medical aid. So there is bite-sized approaches that can be done. We feel the choice element is going to be a massive issue for debate, and I'm not sure how the opponents of this bill are going to have to fight it out. So there is things that can expedite this intention as opposed to just a holistic, because we can provide the facilities, but the facilities alone is not everything, and the issue is what else should be done to make this a reality.
Continuing our discussion, and this time speaking to ACDP Member of Parliament Mari Sukas about concerns that they've raised regarding the NHI bill, and it's still the subject of fierce debate, as I mentioned earlier on, especially regarding whether it will be captured by private and political hidden agendas. And these are some of the concerns that have been attached to this NHI bill, and the ACDP also adding their voice to concerns which have been raised by parties, amongst them including the DA, the EFF, the ACDP and the Inkatha Freedom Party, which are among the parties that have expressed outrage over the passing of this controversial bill. Speak to the private sector. We have from RH Bophelo, Quinton Zunga, joining us for this conversation. Now, as RH Bophelo, Quinton, you believe that you can work with the government to improve the state of healthcare in this country. Give us just your quick remarks on this aspect.
Yes, I think we have been investing in healthcare infrastructure for the last 10 years and have 34 hospitals in 8 of the 9 provinces. So we do have capacity to take on NHI patients. Obviously, the detail is the pricing and resourcing and how that transition is actually done. And it is important to note that this transition needs to be managed carefully because at this stage, we don't know how the government is going to procure. And that is where the concern lies. We have capacity and the government can use it. But obviously, we asked the question, the government could have started using us a long time ago. So if the government is serious about actually working with the private sector, that can happen. It doesn't even need a bill to be implemented. We can start today. But there seems to be some, aversion to a proper partnership. And that's where we want a lot more support because we can help.
Thank all three of my listeners, or rather my guests. That's Dr. Katlego Muturi, the MD for Board of Healthcare Funders. Quinton Zunga from RH Bophelo is the CEO there, as well as Mari Sukas, who's the ACDP Member of Parliament. Also welcoming calls we received from 2 of our listeners as well, adding their input onto this very contentious discussion around the NHI bill and the efforts from the private sector as well, working towards having the largest footprint in South Africa's healthcare industry and really moving to see NHI happen. What is their role? We also asked it during this particular conversation.
You've been listening to a Power 98.7 podcast. For more podcasts, visit power987.co.za or subscribe wherever you get your podcasts.